start na po tayo. What is gout? Gout is a common and complex form of arthritis that can affect anyone. It's characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints, most often in the big toe, sa hinlalaki. Gout is an inflammatory disease in which monosodium urate crystals deposits into a joint, making it red, hot, tender, and swollen within hours. Next. So what are the causes of gout? So makikita nyo sa picture yung healthy joint, no? And then if you have gout or gouty arthritis, may nagbibuild ng mga urate crystals. Gout occurs when urate crystals accumulate in your joint, causing the inflammation and intense pain of a gout attack. Your body produces uric acid when it breaks down purines. Substances that are found naturally in the body. So makikita niyo siya, it's like crystals, parang needle form siya. So masakit yan. There is this, ang description dyan is madaanan lang yan. Depende sa level of gout attack, no? Yun yung tipong madaanan lang daw o mahipan lang yan. Yung part na yan na namamaga ay napakasakit. So ganun siya kasakit. There is this one presentation na ang sabi nila na ang gout daw ay pag umatak daw yan, yung pinaka-severe is mas masakit pa siya sa may kidney problem. So I did my own research, wala siya dito, no? Na mas masakit pa siya sa taong nanganganak, masakit pa siya doon sa na-aksidente, mas masakit pa siya doon sa may mga severe burns, breaking a bone, childbirth, yan. So ganun siya kasakit, no? Parang it's like i-describe ko siya na parang gusto mong maalis yung part na yun sa body mo. Next. Okay, what are the causes? Purines are also found in certain foods, including red meat and organ meats, such as liver, and it promotes higher level of uric acid. Wow! Bakit mataas ngayon ang rate mas mataas ngayon ang cases of gout? Kasi mahilig tayo sa samgyup. Mahilig tayo sa mga steak, di ba? Parang naiba yung pagkain natin. Hilig natin sa sugar. Hilig tayo sa mga milk tea, tambay ng Starbucks, ice cream, yogurt, everything. So yan yung mga sugary at saka yung mga high in purines, like yung mga laman loob, sisig, papaitan, what else? So alam niyo yan, basta laman loob. So normally, uric acid dissolves in your blood and passes through your kidneys into your urine. But too much uric acid or kidneys excrete too little uric acid, it can build up, forming a sharp needle-like urate crystals in a joint or surrounding tissue that cause pain, inflammation, and swelling. So kung makikita nyo siya, yan, that includes beer, yung mga manginginom, yung mga mahilig, yung mga naninigarilyo. So siguro, isa sa mga yan, machi-check natin. Ako siguro, machi-check ko siya lahat. I drink occasionally. So shellfish, yung mga seafoods, shrimps, mga talaba, yung mga seafoods na walang kaliskis. Yan yung mga like mackerel, kasama yan, sardinas, tuyo, yung mga yan, processed foods. So ang tanong, ano pang kakainin ko pag may kung may gout ako? So mamaya explain natin yan. Next slide please. Okay, what are the symptoms of gout? Intense joint pain, yung in-explain ko kanina, no, namamaga siya. Gout usually affects the big toe, but it can occur in any joint. So yung iba nag-start yan dito lang sa hinlalaki. Mapapansin nyo yan, palipat-lipat yan. It's either palipat-lipat or dumadami siya. Lingering discomfort, yung parang hindi mo na malaman kung nasan yung sakit niya. Sometimes nasa talampakan na kasi ano na siya, parang nag-escalate na siya, no? Nagkakaroon ka ng mga stiffness sa muscles mo. may time na parang yung buong leg mo parang naninigas na, yung parang ano na siya, hindi ka na talaga makalakad, no? And lingering discomfort after the most severe pain subsides, some joint discomfort may last for a few days to a few weeks. Diba? So, hindi ka na makapagtrabaho, magsisiklib ka. So, meron kami mga empleyado before na every Monday, nakasiklib. Bakit? Kasi uminom nung weekends. Kinain lahat, kumain ng mga laman loob, uminom, nagsigarilyo and all. So, kaya the following day, ayan, ang taas ng uric acid and then gout attack na. Inflammation and redness, the affected joint or joints become swollen, tender, warm, and red. So, limited range of motion. As gout progresses, you may not be able to move your joints normally. Ang pinakamasaklap niyan, hindi ka makalakad at kakailanganin mo na ng tungkod or wheelchair and you cannot even move, no? So, it depends on the grade or level of the attack. Next. Okay, underlying gouty attack. The underlying cause of hyperuricemia. Ang hyperuricemia means ito yung uric acid level. So mataas siya. Too much uric acid in the blood which result in the formation of sharp needle-like crystals in areas with slow blood flow like the joints and the kidney tubules. So makikita nyo, di ba, no? So namamaga siya. Next. There are stages of gout, asymptomatic gout. So medyo familiar na tayo sa term na asymptomatic, no? Hindi mo alam na nagbi-build up ka na pala ng mataas na pala yung uric acid mo, na nagbi-build up ka na or na-fabricate na yung crystal, na-form ng crystal sa mga joints mo. Pero hindi mo siya napapansin, hindi mo pa siya nararamdaman. That is prior to the attack. So it's very, very important to check our uric acid level once in a while sa blood natin. So para na-rule out agad natin. So next is acute intermittent gout. So when you say acute intermittent gout or intermittent means may pasulpot-sulpot. Meron ngayon, masakit ngayon, tapos few days mawawala, tapos babalik naman siya, pabalik-balik. So ikot-ikot lang siya. Why? Kasi yung level ng uric acid, hindi siya na-address. So the attacks begin 3 to 10 days, and then sometimes, yan, yung mga fever, ano yung mararamdaman mo? May stiffness, swelling, redness, fatigue, and sometimes fever. So para kang nilalagnat. Chronic tophaceous gout. So ito na yung advanced stage, no? Urate crystals form hardened lumps. Yung alam mo yung pag hinawakan mo na siya, mararamdaman mo na may mga bilog-bilog na siya doon, para siyang parang kulani na maliliit. Basta may bilog, para siyang may buba. Parang may sago doon sa area na yon. And then kumakalat yan. So halimbawa, doon sa hinlalaki mo, pag pinrest mo yung talampakan mo, makakapa mo, may mga bilog na maliliit, and those are crystals na na-form na dahil mataas yung uric acid mo. Next. So what are the stages of gout progression, kung paano siya nagpo-progress? So of course, number 1, high uric acid level. So ito yung nagpo-form na siya, kagaya ng kanina, yung asymptomatic, hindi mo pa siya mapapansin, wala pa siyang pain. And next is stage 2 is the acute gout. Symptoms start to occur, causing a painful, yan na. Medyo nararamdaman mo na yung sakit. And next is intercritical gout. Ito na yung may flare na siya. Yung flare, yung namamaga na. Yung una, may masakit na siya. Pag hinipo mo siya, masakit na siya. Medyo pumipintig-pintig na siya dun sa affected joint, no? Pero yung stage 4, ito na yung may manifestation na ng pamamaga at pamumula. Next. Okay, what are the risk factors? Diet. So, yung sinabi ko kanina, yung mga worst food, sinabi ko na, di ba, yung mga high in fructose, ibig sabihin niya yung mga sugary, yung matatamis, yung mga poor diet talaga ka second cause gout, alcohol, liquor, cigarettes, kasama din yan, mga laman loob, red meats, and then yung mga seafoods na walang sardinas, malakas yan, malakas ang purin yan. Sabi nila sa ano daw, sabi nila munggo, some are telling munggo, yung mga beans, mataas ang purin yan. So based on experiences and mga research din na nagawa ko, may mga iba-iba. Merong iba na natitrigger sa pagkamain lang ng munggo the following day, masakit na. Meron namang iba hindi sa munggo, meron namang iba sa red meat. Pero ang in most cases, yung mga mahihilig sa red meat, laman loob, yan, mga dunuguan, at saka ang pinakamatindi talaga dyan ay yung mga yung umiinom, yung sa alak, okay? But wait, okay, so it is advisable for those who have gouts to lose weight, no? Kasi nga hindi kinakaya ng katawan, lalo na sa knee area yan, hindi kinakaya pag overweight ka. So that can trigger gout attacks, okay? Medical conditions, what are the medical conditions that can affect gout, no? So ito yung mga tinatawag na mga autoimmune diseases. Ano ba yung mga autoimmune diseases? Like lupus is one, heart conditions, high blood, diabetes, thyroid problem, hyper and hypothyroidism. So certain diseases and conditions, the risk of gout, yun sinabi ko na kanina yon. What else? May na-miss pa ako? Kidney, yan. May mga sakit sa kidney, yung mga obese. And yung may mga metabolic syndrome. Ano ba yung metabolic syndrome? Ito yung may problem sa mga sa metabolism. So pag hindi maganda ang function ng kumbaga yung metabolic system mo, so lahat yan magbi-build up, and that includes uric acid in our blood. So what are the certain medications? Low dose aspirin. So yung mga aspirin, ano ba mga aspirin? Aspilet. I think kasama din dito yung mga blood thinners na tinitake ng mga hypertensive, yung mga hypertension, yung mga diuretics like Lasix, yan. And ACE inhibitors and beta can increase uric acid levels, okay? Bukod sa pagkain, bukod sa weight mo, bukod sa medical conditions mo, may mga certain medications na nakakapag trigger ng gout attack. And then check your family history, baka merong lahat sa inyo ay may gout or rheuma or arthritis sa family nyo. So, yan pa lang makikita nyo na, matitrace nyo na yon. So, age and sex, mamaya didiscuss ko kung sino ang may mas maraming gout attacks. At saka yung may mga recent surgery or trauma. Siguro yung, let's say, yung dati ka nag-workout, okay, na-aksidente ka, there is one part ng body mo na medyo na-damage na yon. That particular part of your body is, ang tawag dito, prone to gout attack or inflammation. Next. Okay, there is this conducted clinical study about dito sa Philippines, no, about gout cases. A Philippine Tertiary Hospital Cross-Sectional and Registry Feasibility Study, Gout Clinical Case Scenario. There are 108 patients na tinest, no? So, median age, 58. So, wow, 26 to 80 years old. So, magtataka ngayon, ako may mga pamangkin ako na, sabi kasi dati nila, parang tatago mo pag may gout ka o rheuma ka o arthritis ka, yan, sakit ng matanda yan. But surprisingly, nagulat ako na ako kasi nagkaroon ako ng gout when siguro mga 5 years ago. Why? Kasi nag-keto diet ako, nag-high protein diet ako. So, ibig sabihin nun, tapos kulang ako sa water, no? So, yan, yung mga on a diet, yan, be watchful kasi medyo prone ka dyan sa tataas ang uric acid mo. But there are, I suggest naman na when you're on a diet, siguro masasabi ko na mag-veggies ka na lang, mag-vegetables ka na lang. Okay, 26 to 80, so mga 50 plus ang nagkakaroon talaga nito. Pero as early as 20s, meron na because of poor diet and lifestyle. 98% male, okay. 2% female. Sino to mga to? Ito yung mga nagme-menopause na at may mga chronic kidney diseases. And yung may mga, sinabi ko kanina, may mga autoimmune diseases. So yung gout or high uric level, high uric acid level is just a symptom of these autoimmune diseases. So medyo expected na natin kapag may diabetes ka, pag may hypertension ka, meron kang heart problem, meron kang sakit sa kidney, or obese ka, so candidate for gout. Next. Okay, what are the stages of gout? There are 9 stages, no? So makikita naman natin dyan, no? Hindi ko na-discuss, no? Stage 9. Stage 9, ito yung pinaka malala. Ito yung chronic, go to severe. Ito yung severe. So, siya yung stage 9. Makikita mo sa table 2, pinakadulo sa baba, 29% ang meron yan. Okay? Sa studies. And then 16% yung nag-uumpisa pa lang, yung at least 1 attack per year. So, occasional lang siya. Maybe siguro lang, sunod-sunod yung happening, sunod-sunod yung, alam mo na, siguro marami nagkakaroon ng mga gout attacks during Christmas seasons kasi lahat kinakain. Tapuyat, inom, kain, so walang diet, di ba? And 15% ng stage 2, ito yung mga nagkakaroon ng 2 to 6 attacks in a year. And then pinakamataas na percentage, ito yung stage 4 to 9. So yung 4 to 9, ito yung intermittent symptoms, ito yung magkakaroon, mawawala, yung pabalik-balik lang, up to severe, ito yung 62%. And most patients had advanced gout na. Okay? So what are the medical conditions and lifestyle? Ang pinakamataas, kita mo siya sa baba, di ba? Umpisahan natin, hypertension. Mataas din siya, almost half ng may mga gout attacks ay hypertensive. Yung 36%, ito yung may mga kidney problems. And 65% yung manginginom. Okay? 57%, mataas din yung mga smokers. 10% lang naman ng obese, no? So, manageable pa siya. But we suggest na mag-lose, it's better to lose weight pa rin. Number 2 is the metabolic syndrome. So, yun yung may mga, mga autoimmune diseases, yung may mga problems sa metabolism. So, makikita mo rito yung mataas. In number 1 is yung mga drinkers, liquor ang pinaka culprit when it comes to gout attacks. Tsaka yung smokers. Number 3, yung may mga hypertension. Okay, so checkan natin dyan kung present ba sa lifestyle natin yan or one of the. Huwag na sabihin sana all. Isa tayo sa mga yan. Next. Okay, ano yung mga body areas? 52% ankle. 40% yung MTP, sabihin, metatarsophalangeal joint. Okay. So, ano ba yan? Hinlalaki ba yan? Yan, sa gilid. Yan. And then, 46% 2 or more joints, pwedeng yan. Makita mo dito sa picture na to, 4 na, apat na areas yung meron dyan. Yung hinliliit, hinlalaki, bukong-bukong, at saka ano ba yung sa inner. Yung tawag dito? Yung sa may talampakan. Malapit sa talampakan, yung inner. Di ba yung sa labas, bukong-bukong, yung sa loob nun, yung opposite side nun, is yung area ng inner. Okay, 54% yung monoarthritis, ibig sabihin, isang area lang. Next. Okay. Ano yung the usual na piniprescribe ng mga doctors? So, maraming nagpe-prescribe ng ibuprofen, ay yung mga NSAID, yung mga pain relievers, 77%. These are just pain relievers. Pero yung symptoms lang yung nako-correct. Okay, mawawala yung inflammation, swelling, but still, nandun pa rin yung uric acid. Hindi na-address yung pinaka-root, no? And then 62% yung colchicine, ganun din siya. Ano siya? Formulated siya for gout and the arthritis attacks. So pag tinake mo yan, mawawala yung pain, pero still babalik yan kasi hindi naman na-lower yung uric acid. 44% yung allopurinol. So ayan, medyo nakaka-lower din yan ng uric acid. But still, for me, well, synthetic siya eh. Ako, being a health, wellness, and beauty advocate, so for me, I believe in natural medicine. So pwede i-combine, no? At first, pwede nating i-combine yung, let's say, yung mga supplements with these products. And 37% yung febuxostat. O masakit yan. Kasi yung iba kino-combine nila yung colchicine at saka yung febuxostat. Yung febuxostat, iinumin mo yan, parang ano na siya, maintenance na eh. Ang masakit dyan, kapag ininom mo yung febuxostat, nang meron ka ng attack, mas lalo siyang masakit. So, mamaya may solusyon na tayo para dyan. So, conclusion, there's an increased incidence of gout in the young and an increase in comorbidities prevalence. Okay, next. Okay, prevention. How to prevent? Hydrate. Water. Kapag one of, yung in-explain ko kanina kasi sa mga nagda-diet yan, nade-dehydrate yan. So mapapansin niyo yan, nade-dry yung mouth nyo. So it's a sign na mag-hydrate ka. So ang isa sa sa gout is para ma-flush out yung uric acid mo, yung mga crystals diyan sa joints mo is to drink a lot of water. So one of the easiest and most significant ways to prevent or ease gout flare-ups is to drink more water. So yan ang pinaka-natural na gamot sa gout. Okay. Get some rest. Use a cold compress. So lagi ka may cold compress diyan. And then stop drinking alcohol. Avoid purines and sugar, yung mga sinabi ko kanina, mga pagkain. So pag tinanong mo ko, halos wala na akong kakainin dito. Parang patayin nyo lang ako, parang gano'n, di ba? So parang hindi na, titignan mo parang hindi na, wala nang quality, di ba? Pag may sakit ka, gano'n eh. Bawal to, bawal yan. Anyway, eat more fruit. So there are certain fruits that can benefit people with gout. Meron nga sabi yung mga mabubuto, bawal, sabi nila. And sa mga fruits, maganda yung mga berries. Ay mga strawberries, okay yan. Tapos sa naman, sa gulay naman, yung mga green and leafy, yan, okay lahat yan. Mga pechay, kangkong, spinach, kale, ano pa ba? Lettuce, pichugas, okay, mga yan. So salad is okay. So exercise and lose weight. Daily supplements, yan, omega fish oil, okay yan. Vitamin C and digestive enzymes like yung mga pro and prebiotics and magnesium. Okay. So eliminate yung mga soft drinks. Kahit diet soda pa yan, so bawal siya. Okay, next. Okay, thank you. In yung first part of our presentation, we talked about the gout. Ngayon, dito na tayo sa solusyon. The natural solution and natural medicine for gout. Okay, ganda ng pangalan. EZGout. EZGout, EZGo. Okay. So, napakagandang food supplement nito. Natural lang siya. It will address all yung pinakita ko kaninang mga gamot. So ito, it works in several ways, not just for gout. Okay, next. Sige. Move on. Why choose EZGout? Bakit? Because it's natural, no? It contains quercetin. Quercetin is one of bioactive compounds that has been studied and reported in anti-hyperuricemic effect through several mechanisms, including reducing urate production by inhibiting the corresponding enzymes and increasing urate excretion by regulating renal urate transporters. It is an antioxidant, anti-inflammation, and amelioration, so prevent of metabolic syndrome. So yung mga pag nagpo-progress, para mag-progress yung metabolic syndromes. or yung metabolic system mo, sorry, and cardiovascular diseases, which are comorbidities of hyperuricemia and gout. When I say hyperuricemia, ito yung mataas yung iyong uric acid level. So saan mo makukuha yung quercetin? Capers, mahirap hanapin, di ba? Kakainin mo ba yan? So hindi mo na kailangan kumain yung mga yan. Elderberry juice, okay yan. So hindi mo makakain, di ba, radish? So yan ay inilagay na yan ay isa sa mga active ingredients of EZGout. Okay, so maganda siya for uric acid level para ma-maintain niya, hindi mababa, hindi mataas. So it regulates your uric acid. And quercetin is also known as natural antihistamine. So yung may mga hika or asthma. Next. Okay, cherry tart. So kanina quercetin, ngayon cherry tart. Ano yung mga benefits niya? Ito, hindi lang siya for gout, di ba? Beneficial for improving sleep quality and managing sleep disorders. Okay, it decreases risk of type 2 diabetes and heart disease. So maganda rin siya for diabetes and heart ailments. May help to relieve pain from inflammatory and osteoarthritis. So it's a natural pain reliever. So it lowers the risk of stroke. Wow, di ba? So, and then it also improves muscle recovery after exercise. And it may help in cancer prevention, reduces inflammation, may help combat gout, reduces belly fat. Nakakapayat din siya. So basically, cherry tart is an anti-inflammatory. It's a natural pain reliever with so much health benefits. Nakakapayat, maganda rin for sleep disorders, good for the heart, good for sugar level, and it also prevents from cancer, from having a cancer. So it has an anti-cancer property as well. Next. Okay, celery. For healthy joints, it treats arthritis, rheumatism, and gout. It helps in lowering the swelling and the pain around the joints due to its anti-inflammatory. So, pain reliever, tapos for anti-inflammation din siya. So, yung pamamaga, yun yung tinatarget niya. It is also effective in enhancing the regrowth of tissue in inflamed joints. O isa sa maganda sa kanya is kapag nagkaroon ka ng gout, so nasisira yung mga tissues surrounding it, the area, no? Nadadamage yan. So once it's damaged, ang maganda pala na ginagawa ng celery is it helps to regrow those damaged tissues. Okay. Celery seed contains compounds that may be beneficial in treatment of gout. Luteolin may reduce. It also reduces uric acid level. So these three ingredients, EZGout proprietary blend, yung synergy effect niya, kung makita mo, is anti-inflammation, nakakababa ng uric acid, and then it repairs your tissues. What else? So it works in many ways, diba? So hindi lang siya for pain. So isa lang yung iinumin mo. So these benefits might reduce the frequency and severity of painful gout attacks. Okay, next. Because of its three main ingredients, cherry tart, quercetin, and celery synergetic effect, yung sinabi ko kanina. Ano yung mga benefits niya and how does it work? It works as an anti-inflammatory supplement and immune boosting supplement. Wow. So, meron siyang property as immune booster and anti-inflammation. Inflammation is the root of most diseases, and all these three ingredients reported to effectively fight inflammatory related conditions such as, ano ba yung mga yun bukod sa gout? Atherosclerosis. So ito yung mga arteries ng ano natin, ng heart natin. So ano siya, parang kiniklear niya. So, yung flow ng dugo or ng circulation ay na-address niya. So, it acts as anti-inflammatory nga. Sabi ko kanina, relieves pain for gout, chronic fatigue syndrome. O yan, yung may mga adrenal fatigue syndrome, yung mga nagme-menopause, yung may mga hormonal imbalances, yan yung may mga chronic fatigue syndrome, yung masakit yung likod, masakit yung talampakan. So, yun yun. Skin disorders, kasi ang celery maganda yung nakakinis yan. Nakakinis ng skin. Insulin resistance and diabetes, yun yung may mga yung mga autoimmune diseases nga. Stomach ulcers, it improves endurance, lowers uric acid level, decrease risk of diabetes, and lowers risk of stroke. Next. Okay, B, it has cancer-fighting properties. Studies have shown that quercetin, cherry tart, and celery were able to restrain the growth of cancer and prevent proliferation of cancer cells. Wow, one good news yon. Okay, isa sa magandang benefits yon. So yung kunyari, umiinom ka for gout, yun lang yung target mo talaga. But there are other benefits na makukuha mo from EZGout. Cardiovascular health. Quercetin was able to reduce some of the major risks of the heart diseases such as high blood pressure, oxidative stress, and inflammation. And it also has, letter D, antiviral properties. All three were effective in the prevention or respiratory conditions as well as fight against viruses. Okay, so ako, malakas ang quercetin ngayon, lalo na nung pandemic, no? Because quercetin has this antiviral properties. Maganda siya for yung respiratory system natin kasi nga ang tawag sa kanya is a natural antihistamine. So yung mga may hika o asthma na hirap sa paghinga, yan ang main benefit ng quercetin. Ayan, letter E yan, sinabi ko na pala. Asthma. So quercetin was able to reduce inflammatory cells of the immune system as well as decrease the histamine levels, which then helps to smooth the muscles of the airways and helps with breathing. So kaya maraming nagtitake niya nung may mga na nag-positive sa COVID. Next. Okay, anong advantage ng EZGout over NSAID na sinabi ko kanina, other medications such as yung mga ibuprofen, Arcoxia, ano ba yung mga Advil, mga yung mga colchicine, febuxostat. Ano yung advantage niya? Number one, it's natural. It's a natural alternative to all other drugs. So, wag naman, kumbaga, parang ayaw na naman natin masyadong kalabanin yung pharma. So, it all depends on the level of gout attacks. No? Mamaya explain ko yon on how to take it. It almost no side effects. EZGout is also good for urinary tract system and kidney. So yung may mga sakit sa bato, yung may mga kidney problems, maganda ang EZGout. So kasi 'di ba connected 'yan yung kidney natin sa uric acid level natin o sa gout. Sabi nga nila kapag meron kang kapag may gout ka, pa-check mo yung creatinine mo. And most probably kasi in most cases related siya sa kidney. Okay. Kidney disease can lead to a high level of uric acid in your blood. So kung nakita mo mataas ang uric acid, chine-check din dyan yung creatinine. Commonly associated with gout. Next. Okay. Eto na, on how to take it. Supplementation. So why? Kailangan ng supplementation. Lahat can take EZGout. Dun sa mga sinabi kong pagkain, lifestyle, so if you're one of them at lahat yun ay present or red flag sa inyo, I suggest na mag-supplement tayo with EZGout. So 1 to 2 capsules per day before meal. So kasi ma-address naman yung mga ibang ano natin doon yung mga ibang health benefits at saka yung ibang health conditions natin, di ba? So gout treatment. For gout treatment, halimbawa, ngayon ka palang magtitik ng EZGout, no? Sobrang inflamed na siya, malala siya. I suggest na you can still take yung mga matitinding, yung iba, kasi talagang kailangan mo na ng steroids kasi sobrang namamagana siya. And para ka nang nilalagnat. So, yung sobrang advanced na, I suggest na you can still take, let's say, colchicine and yung mga pain reliever like Arcoxia. But I suggest na isabay mo na si EZGout. Why? Kasi EZGout works in different ways. So yung sinasabi ko nga, yung mga yun, ina-address lang nila yung swelling and inflammation. While EZGout, yung symptoms lang ang kinagamot niya. While EZGout, ginagamot niya yung pinaka-root cause of gout. Okay. So, what else? Next. Okay, testimonials tayo. Ito, 3 days. Okay? From Mr. Frederick Ramos, 50 years old, lalaki. Ang alam ko, ang lifestyle nito, umiinom, naninigarilyo, so poor lifestyle, napupuyat, and 50 years old na siya. And sa family din, meron ding sa history, may dalawang, ang tawag ito, both sides may history ng arthritis or gout. So treatment usage, 2 capsules with meal 3 times a day. So 2 lang tinake niya. So makikita mo sa left, magang-maga. Second day, third day, ayun na, wala na. Normal na, wala nang maga. Sabi, ang galing. Okay, next. Okay, testimonya. 72 years old. I used to take colchicine, yung sinabi ko kanina. Colchicine and febuxostat as maintenance for my uric acid. Imagine mo, maintenance yun. Hindi alam kung paano nasisira yung kidney natin kapag we're taking synthetic drugs. So, for severe gout attack and pain, I take Arcoxia. Wow, isa pa yan. Sira kidney mo yan. Hindi yan mini-maintain. Then, a relative gave this product to me. At first, I was skeptical, but since it was just a freebie, bigay lang pala to. I took it while I had a severe gout attack. I stopped all my maintenances. Wow, nag-take siya ng risk. And I didn't take the pain reliever. Rather, I started taking the pill for gout. Okay. 2 capsules per intake, maximum of 6 capsules a day for treatment. I felt swelling na wala. So I was able to walk normally on her 3rd day of taking EZGout. Next. Okay, so ayan, meron 59 years old. Ito, very severe ang kanyang gout. Nagkaroon na siya ng, alam ko dito, nagkaroon na ito ng complication na dahil sa steroids. So ngayon, bawal na siyang kumain, kahit anong kainin niya, bawal. So one good thing with EZGout is it will really ease your life. Okay, makakain mo na siya lahat in moderation. Okay, so let's say ganito, I suggest, iinom ka ngayon. O para naman, sige, occasional drinking kasi may party, di ba, to celebrate. So I suggest inom ka na agad ng 2 capsules para hindi na mag-escalate yung uric acid mo and you can enjoy the party. So high uric acid, 40 years old, seems to be working kasi I have slight swelling on my knees and my hands. So, nawawala na yung swelling and inflammation. Next. Okay, who are not allowed to take EZGout? EZGout is not recommended to individuals who have allergies to cherry, celery, and food that has quercetin. How long will I take it before improvements can be seen? It depends, but we have testimonies from people who have seen result in just 2 days. So when I say, pag sinabi mong 2 days yan, first day, meron ka na mararamdaman. So ano siya? Accelerating, progressing yung niya, mararamdaman mo yung paggaling mo. Amazing results can be seen when you follow the recommended dosage instruction. Better results when partnered with exercise and proper diet and hydrate. Pregnant, breastfeeding moms, or taking contraceptive pills. But for me, you better ask your doctor pa rin kasi ang mga doctors naman, ano sila, aggressive sila, and they are in authority kung pwede kang mag-take kahit ng mga supplements. But as a protocol, as an SOP, talagang bawal yung mga pregnant women, breastfeeding moms, or yung may mga special cases or medical conditions. So we know that EZGout is a safe and natural but we still recommend our clients not to take EZGout. Best is to consult their doctor first before taking any. Next.